You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, according to my first guest, no more dentures, no more traditional dentures. We're talking about dental implants today. According to Dr. Anderson, he says you could walk in his office without teeth and walk out with a fixed set of teeth. We're talking about dental implants. With us, we have an expert on the topic, Dr. Tom Anderson. Dr. Anderson, welcome to the program.
Thank you. It's a pleasure to be here.
Now, is that really true? I mean, in certain cases, everything goes right. They're walking with dentures and they walk out with teeth.
It really is true that you can walk out with functioning entirely differently, feel so good about your smile, have people be able to eat things they haven't eaten in years, eat a diet that's better for them. It's incredible what can be done, Randy.
Now, are there a lot of people in Idaho, I guess across the country, but are there a lot of people where you live that have either an upper or lower denture?
There are a lot of people that do wear dentures. I mean, you could fill a stadium full of those people, and they don't really know what's out there.
They don't know about dental implants for the most part?
A lot of them don't, Randy. You know, they have dentures, they assume that that's as good as it's going to get. And then in addition to that, maybe the process that led them to dentures makes them feel like they don't want to be involved in dentistry anymore. So I would love to have people realize what they can get, how much improved function they can get, how their self-esteem goes up, what they can eat, and what they can avoid in the future.
Now, when you say improved function, they can eat whatever they want, but like what? So with like 2 dental implants locking down a denture,
they can eat so much better than they could if they didn't have those. They can eat pizza, they can eat bread, they can bite off sandwiches. It's a world of difference in what they can do. In fact, most people that have lower full dentures and nothing to hold them feel like their teeth are running down the street in front of them and they're trying to catch up.
Is that what they tell you?
Yeah, I've heard that a lot. And
so people don't like their dentures? I mean, I know a few people with dentures and they don't complain.
You know, a lot of people actually would say that they do like their dentures because they just don't know how much better it can be. Now, we see a lot of people too that say, I can't stand these and I need to do something different. But everyone would benefit from just, even if you could only do 2 implants anywhere in the mouth.
To give them a full arch of teeth.
Exactly.
Snaps in, snaps out.
Snaps in on the lower, feels so much more stable. They can laugh. They can interact with intimate relationships so much better when they're just talking to anyone.
Okay, and what about adhesive? Like with just 2 implants and a full arch of teeth?
With just 2 implants, no more adhesive.
Okay.
You don't get nearly the food impaction underneath. They don't slip. You know, they don't have to worry about laughing and have their teeth fly out or skydive and see them go away.
How old can you be to get it done?
Any age. You can be 80, 90, 100. And implants can change so much about how people feel and how they function. So, gosh, you know, who doesn't want to live a quality of life that you can eat what you want, smile the way you'd like to?
Are they more likely to fall out if you're 80, 90 years old?
No.
Really? I mean, scientifically,
you know, success
there's
rates
data to back that up?
Yes. Yes, and implants are carefully placed and planned implants. 98% success rate, Randy. I mean, it's hard to beat that. That's incredible, right?
Okay. What about pain? It seems very painful.
You know, people think about that, and you think it would be. Make a small opening in bone, but you know, bone doesn't have much sensation, if at all.
Okay.
And the soft tissue has some. But it's been incredible to me to watch. I hear it over and over. People get implants one day, you might even adjust or change bone a little bit, and they take a Motrin, and that's it. I hear over and over, it's not nearly as painful as I thought it would be.
Now to your practice, because you just don't do dental implants. I guess you have a general practice. You do everything. So who's a typical patient that you see?
You know, I view them, though, Randy, that there is no typical patient, that they're all individuals. They all have goals and individual needs, and we say that to them when they come. We say, you know, Mrs. Jones, my goal is to get you informed so you can make a good informed decision for yourself. And so they're the boss. But when they come, we do everything. We do everything from just minor tooth bleaching to some minor contouring of teeth, which can make a huge difference for someone. We also do a ton of sedation, Randy, a ton. We've been doing it for years. Sedation's incredible for the high fear patient.
Are there a lot of people like deathly afraid of the...
A lot of people that can't even sit in the dental chair, and this can change everything. I mean, it would have been nice for this to come about even before it did, but people's anxiety goes way down. Time passes and it seems like just minutes to them. In fact, I get asked often, have we done this yet?
So it means they do the procedure, like dental implants or whatever, and you're saying they wake up and they're going, that's it?
Isn't that amazing?
Is that right?
I hear it
Is that
all
right
the time.
that happens?
Yeah. Are we started yet? And the recollection of the events, people remember nothing. So it's a great service for a lot of people. We've been doing it for years, and I've seen people grow past their fears, where maybe you just sedate them once or twice, and then they don't have to do it anymore. And how nice is that, to conquer some of those childhood fears that have been around in them forever? Because we do so much sedation, Randy, it's also important to give people what they need so they can get everything done there. They're not re-sedating over and over. And so we do a lot of things. We can do tooth bleaching, minor contouring, we do orthodontics, we do a whole lot of implants, we do wisdom teeth extractions, a lot of oral surgery, we do crown and bridge, root canals.
You do root canals?
We do root canals.
Yeah, I mean, we talked on the phone. I mean, you have this, and I'm paraphrasing, but like a one-stop shop or all under one roof?
Yes.
They can get things done?
Yeah, I feel like that really serves people to be able to take care of what they need. And for people that have limited time, it's a great way to go for them. Or people that have huge gag reflexes.
Okay, and the dental implant crowd?
Dental implant.
What are the categories, if you had to categorize people that are getting this done?
You know, sometimes with dental implants, people need just a single tooth replaced. Occasionally, you'll be replacing more than a single tooth, and sometimes entire dentitions. But implants have revolutionized dentistry, revolutionized people's health.
What do you mean it's revolutionized?
Well, you know, it used to be that when people lost teeth, oftentimes some type of denture was the only place to land.
Okay.
And now you have something to anchor into, to build teeth onto.
Okay.
It can change everything.
Now let's talk a little bit about your background and training. I guess you told me half your family are medical doctors.
Yes.
The other half are dentists. Your own son's a medical doctor.
Yes.
So when did you know you want to be a dentist?
You know, I wasn't sure for a while, but dentistry is where I'm supposed to be. I was accepted to medical and dental school, but I love dentistry. I love the fact.
Why did you pick dentistry over medicine?
Initially, I just wasn't sure, and I was accepted to both.
Okay.
But as time went by, dentistry is where I belong.
You think you're better off than your medical doctor?
I love what I get to do. I get to deal with people's self-esteem. We make things better.
Okay.
And maybe not deal with instances that are headed downhill so much. We can change how people feel about their self-esteem, how they eat, how they function, and yet, you know, that mouth is a window to the rest of the body. So many things are interrelated. The things we do affect the body, affect Alzheimer's, diabetes, different things like that. So I love what we do.
Before we go into options for denture wearers with dental implants and the process of what to expect, your background and training, you said to me that, you've been doing this since 1987.
We've been doing this for a long time, Randy. And I was the first dental student at Creighton University to place implants. According to them, the first in the nation.
Okay.
And we have enjoyed that. I've been to lots of education after that with implants. Work with an incredible lab to produce results that you just don't see every day. The teeth that they produce, nobody knows their teeth, and yet they'll be bright and give people tremendous confidence. The work that we do just turns out incredible. It does change lives.
But I feel like I can spot a denture. So these are like real looking teeth.
These are real looking teeth, Randy. The lab, he produces so much lifelike appearance in these teeth, and the light passes through them in a way that just produces a lot of vitality. So people look vibrant, they look younger. Just restoring their teeth can make a huge difference. And people look at smiles first. I mean, what more do we have to offer the world than just a smile?
Now you, since 1987, what's changed? I guess, you know, that people could go in with missing teeth, and you can not only give them the implant, but the tooth on top in the same day in certain cases. So why is that? Why can it be done so quickly today is my question.
So much has changed in that time. You know, we have the ability to do scans that show us exactly where to place those implants, where the bone is best. The implants are coated with different materials that allow the bone to fuse to that sooner than it used to
Okay.
be. The way we can tighten those implants into bone, you can quite often have people leave with teeth that are functioning, and they go from really not functioning in this world to something entirely different.
So you brought photos of people that I guess were either headed for dentures or have dentures, and now with dental implants they have teeth that don't come in and out. So tell me about it.
We brought photos and some great stories,
Okay.
Randy. This is Tammy. It's an amazing story. It'll tug at your heart in a
Okay.
huge way. She came to us and she was missing teeth. She had no back teeth hitting. Her upper and lower jaws came closer together. It made her look older, made
Okay.
her look like she just wasn't smiling. But she couldn't eat the things she wanted to. But what's more compelling, what's amazing, Randy, is that her husband was terminally ill. He wanted to see her smile before he passed away.
Okay.
So we were on the clock. She needed several implants. She needed some teeth extracted. She needed some minor orthodontics. We opened her bite. We did some crown and bridge. And wait till you see what a difference that has made. It's just been huge.
And she was headed for dentures?
She was headed for dentures.
Because nobody wants dentures.
To have
obviously.
no teeth. And what a different world that is to not have them and to see where she is now.
Let's take a look.
And see the confidence. This is just amazing.
Wow. Very nice.
And now Tammy can eat anything she wants. She smiles all the time. She even dresses differently, Randy, because of what she's done. And even though her husband's not here anymore, there's just a huge difference in how she presents and sees herself. And what a
So is
pretty
that
gal.
common? Like what's going on with her?
It's
as far as
very
like headed
common.
for dentures?
We see it everywhere. And you know, she came to us in time that you could do a lot and save her dentition.
Okay.
And she is, at this point in time, able, she smiles big, she dresses different, she interacts with the world completely different. Even just looking at the pictures and how she came to the dentist, she's dressed completely different. One last thing, you know, if we look at this, she has spacing between
On the
those
before.
teeth. On the before. And you know, she has large openings on the side. Her teeth don't match the lip line at all, and if you look at the afters, it follows perfectly.
So the teeth kind of match,
Oh.
and this is all by design.
Everything's in symmetry, you know, and it throws people off visually when those things aren't in touch. And now she has a broad smile, a smile that she's comfortable with, a smile that she smiles with confidence, and she eats anything she wants to.
So is this one of those type of procedures when it's all done, especially for the denture wearers, where they say, I wish I would have got this done years ago?
We hear it over and over. If there's one mistake I've made, I wish I'd done this sooner.
Right.
You know, I see a lot of people like Hasty, and Hasty got done with these things, and he can eat things that he couldn't eat before. He can bite into carrots. He eats better nutrition than he ever has. He's able to smile at his wife and not worry about his teeth coming out.
Okay.
And so he's in a completely different place.
Okay, good. Now you have other photos. What are we looking at?
I do.
And you told me, you said, Randy, these are good stories.
These are good stories.
And so what are we looking at
you know,
here?
this is Alan.
Okay.
And Alan came to us, he was a newlywed, just barely married. And his wife brought him in. He hadn't seen a dentist for 40 years.
40 years?
40 years.
Okay.
Isn't that amazing?
Yeah.
And there are a lot of people like that out there that are just sitting. They don't go because they're scared or worried or embarrassed. And they really don't need to be.
So what was going on with him? I mean, you see him, he hasn't been in the dentist in 40 years. What's going on?
You know, over time, Alan had a chronic infection that had just taken the bone away that anchored his teeth. So his teeth really weren't savable. And the choice was to go to just full dentures, which is really the lowest level of dental function.
Okay.
Very hard to get along with. Very hard to eat a good diet. Things slip. Food impacts underneath those. It's not comfortable. So here's what we did for him. We gave him 4 implants up above, 4 down below. We built a set of snap-in teeth that are so tight, Randy.
Okay.
He can eat anything he wants. The other thing about Alan is he'd lost a lot of confidence, and he's a public speaker. So that was difficult. He was a newlywed. So just think how it would have felt to have to go with a full set of dentures or to be where he's been. He's been operating with loose teeth, a chronic infection, bad breath, chronically. We ended up entirely different.
When you say people hold on to their teeth too long, what do you mean by that?
That's true. You know, sometimes people hold on too long and the process just causes more bone to go away that we could have utilized to anchor their implants, to help them be more stable, to help give them an end result that's better yet. So oftentimes if people wait too long, things may deteriorate where things become more difficult, not as functional.
So it's a lot less expensive to do it early, obviously.
A lot less expensive.
Did you use sedation on him?
We did use sedation. So just a great thing for that particular instance. He was fearful of the dentist, hadn't been for 40 years.
Okay.
It's a long time that kept him away. So we came in, we sedated. He was nappish through the entire procedure.
Okay.
And when he left, he had a new full set of teeth. In this case, we were able to place all of the implants while he was sedated. So we kept his appointments to a bare minimum, which is always our goal.
Mm-hmm.
And today, he eats anything he wants. He speaks anywhere he wants. He's so confident. And he and his wife had an amazing relationship.
His wife forced him to come in? Is that what happens? Because guys put things off, right? We don't want to go to the dentist.
You know, women make all the healthcare choices, right? So she just kind of drug him right in. And, but it's wonderful to watch him.
When it's all done, what does he say? Is he going, boy, I should have done this?
You know, it was the funnest thing. He was in the other day and he gave me a testimonial. And he said, I wished I'd done this much sooner. But Tom, things are so great that I can't thank you enough. And those are the rewards that are the best out there. You know, when we hear those kind of stories and people come in, I love that.
Okay, good. Then we're going to take a quick break. We come back, more about the process, what people can expect on day one, and also what all the options are for denture wears.
Okay.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We'll be right back.
As a result of the procedure, this is where I'm at now. I now smile more. I enjoy life. My meals are no longer a question of trying to find a spot in my mouth where I can chew and digest food without it hurting. My teeth are no longer bleeding. My gums are no longer bleeding. You know, I used to shy away from people because I knew my breath was so bad people couldn't tolerate to be around me. You know, that's no longer the case. You know, I now feel comfortable around people. As a result of all these fine things, my life is better. It's a great, great feeling, and I would highly, highly recommend this to anybody.
It's always kind of bothered me that I didn't have a bright smile, and I'm so excited now for the end results of this, for that reasons. And then also just the fact that I knew that my mouth needed some work, and probably pretty extensive work, and it was just a matter of time and money to get it put together to do it, and here I am getting it done. I'm really excited about it, and I think it's going to benefit me greatly in so many different ways.
How many implants he did, but it was a lot. He also did implants in the front on the remaining teeth there to make my smile pretty. All the work he's done has, I think, enhanced not only my eating ability, but also made me want to smile. Before I always covered my mouth when I smiled because my teeth were bad. It's really enhanced my life in more ways than just the eating, just the way I feel about myself.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, he says you could get a locked-in set of teeth with just as little as 2 dental implants. You could walk in his office without teeth and walk out with a full arch of teeth. With us, we have Dr. Tom Anderson. Okay, so that's not an exaggeration.
That's not an exaggeration at all. You know, and it's incredible what can be done. Just with 2 implants, right in the corners of the mouth, Randy, you can get a full set of snap-in teeth. And the person walks out functioning completely different than when they were there. And quite often, we can use their current set of teeth as long as everything's good about it.
Now, when you say they could be functioning different, what do you mean?
Well, they can chew so much more than they could have chewed before. They can eat an entirely different diet. They can laugh out loud and not worry that their teeth are going to fly out on the floor.
Do they worry about that?
I hear that all the time, Randy. My lower teeth feel like they're just going to fall out.
Okay.
And that's so embarrassing for people.
So 2 implants on the lower. That's option 1.
That's exactly right.
What's the next level up?
You know, the next level up, if we can place 4, we'll get more stability yet. With either of these, we get rid of all the adhesives. No more adhesives. A lot less food impaction underneath. And with 4, we can begin to build a full dentition that is so solid in their
So a
bite.
full set of teeth that just
Full
is
set of
locked in.
teeth that just locks in and locks completely down. They can eat anything they want to. At that point, they can eat pizza. They can bite off anything with lettuce, any sandwich.
Is there a particular food that you hear a lot that you're surprised that they love to eat, that they're happy about eating?
Well, a lot of people like to eat steaks, and I
So
had
they tell you about
a
this.
gentleman the other day that said, you know, I'd like pork chops are my favorite thing, and I would just like to be able to eat a pork chop. Something that a lot of us take for granted, but it really changes a lot. And another option, you know, Randy, would be to put 4 implants and have these fixed so they don't come in and out anymore.
Okay.
And that makes a big difference yet. People like that idea that these are not false teeth anymore if they're fixed and they're not coming in and out every night. They love that. They clean around them once or twice a year. In addition to that, we can go 6 to 8 implants.
For like to lock in the lower.
Oh, to lock in the entire lower, and that's really the gold standard. I mean, if we can go there, that's the closest thing to God's work that you can probably ever get.
So they feel like your regular teeth. They look like your regular teeth.
They operate.
And with those, you could eat anything.
You can
right?
eat anything
Like
anything
broccoli,
you
whatever.
want to. Broccoli, steaks, pork chops, anything you want to eat, you can do it with that.
Now, what about the upper? Because isn't the upper dentures are fine because of the suction?
No, you know, I think a lot of people don't even realize what's possible up above. We can build sets of teeth that don't cover the roof of your mouth. You can taste like you haven't tasted in years.
Okay.
They feel like your own teeth.
How many
operate.
implants for the upper?
You know,
To remove that palate, I guess.
If we have 6 to 8, we can do anything we want to.
Okay.
We can also build 4 implants and not cover the palate with a special type of denture, but if we can go 6 to 8 and build bridges that go up there, that's fantastic.
So you've done a lot of these since 1987.
We've done a lot of implants and a lot of these since 19.
So what do they like better, the upper or the lower snap-in denture or fixed set of teeth?
If we have to make a choice, and we'd rather not to, but if we have to make a choice, pick the lower. The lowers are the hardest for people to get used to. To have a full lower denture is so difficult for people to operate with and chew. And they're so loose, they pack so much food, they get chronic sores. If you have to pick one or the other, pick the lower.
So you say you're not too old to do this.
Never
It
too
doesn't
old.
really hurt. It's virtually painless.
Very painless.
Age is not a problem, like you say. And so the main thing is, I mean, your goal here is to just get the message out. to
We're just
denture
getting the
wares.
message out to all those people that just have no idea of what's possible and how it could change their lives, you know. And it's also affordable. It'll never be more affordable than even today. People pay more for rent-to-own furniture quite often. And what's that worth in 5
good
years?
point.
You know, where their smile's worth a ton.
Now, insurance doesn't cover this, Medicare doesn't cover this, but you'll work with them. We should mention that. I mean, I guess insurance covers a small portion.
Yeah, oftentimes insurance does cover a small portion, but you know, people buy things all the time that just aren't worth anything in 5 years. And what are you worth? What's your function worth? A lot of
Okay.
enjoyment is connected to your teeth.
Is this the future of dentistry? Like, you know, I don't know, 20, 30 years, all dentures will be snapped onto something?
I really
Secured by
believe
a-
it is. I believe, you know, implants, we do more of those every day. And there are so many people out there that need this service that can't keep up with it.
Now, we're out of time. So you have 2 more photos. We have time for 1 more.
All right. You know what I want to tell you about Sue?
Okay.
Looks 20 years younger than her age.
All right.
And yet she was headed for dentures. Her teeth were headed downhill, Randy. We extracted some. We did placed implants. We're placing implant bridges. We're crowning a lot of teeth.
Okay.
We're going to open her bite so she doesn't look like her upper and lower jaws come so close together. That changes age huge, just like getting an instant facelift while you're at it. And if you're going to build a house, it costs the same amount per square foot, right? So let's build a beautiful house.
Okay.
This is going to be an incredible result. She's a professional barrel racer.
Oh,
She makes a lot of money. She's in the limelight all the time. She's won national finals rodeo over and over. She's in photo shoots.
but she just had bad teeth.
She just had some teeth that needed some work, a lot of them. And we finished putting in her uppers the other day. We'll do the lowers this next week. Made me feel great. She called me on Wednesday night and said, "You are a rock star dentist, Tom." And it just made me feel so good. But part of that's our team. Part of it's the laboratory that we use. Those things are all important in an end result. You know, when we're done, Randy, because these are just her temporaries,
Okay.
she is going to have an amazing smile. She'll have the best smile on the professional circuit. We were able to brighten her teeth up, fill in where things were dark on the corners, so she just has a beautiful, bright, white smile. And she has a complexion that can take a good, bright set of teeth.
Final message, by the way, and we're out of time. Somebody watching this, they're a denture wearer, but maybe they're still skeptical. They think they're too old. They think it's going to hurt a lot. And you say, it's virtually painless. What do you say to them?
I said, come on in. We'll do a free consultation. We'll just talk. That way we get you informed so you can make a good decision for yourself, because people finish this all the time and say, I wished I'd done it sooner. And we can just spend a lot of time getting you educated.
And you want to wipe out dentures in Idaho?
I
You didn't tell me that, but I was just
do
curious.
want to wipe out dentures in Idaho because people don't know what they're missing.
Okay, good. I want to thank you for coming on the show.
Thank you.
Very nice, very
Appreciate it.
nice. And if they want to go online, your website, take a look at some before and afters, it's all there.
We'd love you to do that. In fact, you can follow these patients through. You can follow Sue through and see her event. You can see people's testimonials.
You have videos that you shot of the patients?
We have videos of these patients that'll tell you what they think. If you get more questions, we're happy to put you in touch with some of these people, because they've said, if we can have someone benefit from our experience, we'd like to do that.
Hey, thanks so much for coming on the show. Very interesting.
Thank
Good job. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.